Hi, my name is Dawn Fulton. I am the nurse manager and expecting you at Punxsutawney Area Hospital. My topic today is going to be how to have a healthy pregnancy. The single most important thing of having a healthy pregnancy would be early and frequent prenatal care. Prenatal care is delivered at our facility by our two board certified obstetricians. That would be Dr. Joseph Mine and Dr. Michael Stever, and our nurse practitioner, Candy Knox. When you go for prenatal care, during your initial visit, they will take your history, your health history, ask you about any medications that you are on, ask you if you're having any problems. They'll do a physical exam. They may even do a pelvic exam on you if it's been over a year since your last pelvic exam. They will give you a folder with all kinds of information on pregnancy. They will also want you to have lab work done, and that lab work includes your prenatal labs, which would be like rubella, which is the German measles, a syphilis test, hepatitis B levels, HIV, your blood type, and what your Rh factor is, so whether you're positive or negative, and a urine drug screen. And then if they do the pelvic exam, they will test for gonorrhea, chlamydia, and bacterial vaginosis. If you're over 12 weeks at the time of your first visit, they will use the Doppler and try to listen to the baby's heartbeat. Prenatal visits are every 4 weeks until you're 28 weeks. And then from 28 weeks, it's every 2 weeks. From 28 weeks to 32 weeks, 36 weeks, it's every 2 weeks. And then from 36 weeks on, it will be every week that you'd be seeing the doctor. Ultrasounds are done initially and then at 20 weeks. And then as needed, if you're a gestational diabetic, you may get more frequent ultrasounds just to watch the baby's growth and development. Your initial due date will be given at that initial visit, and that can be based on your last menstrual period if you're sure of that, or you may not get a due date until after you have your ultrasound done, just depending on how accurate your last menstrual period is. At 28 weeks, you'll have a glucose tolerance test, which tests for diabetes, and it's a 1 hour test. Also, you will have a repeat syphilis test done at that time, and if you are Rh negative, that is when you would get your RhoGAM shot. And the RhoGAM is given to Rh negative moms to prevent them from making antibodies in case the baby has a positive blood type. Other tests that you may have in the prenatal period could be the Clara test, specific carrier tests like tests for cystic fibrosis. You may have a consult with maternal fetal medicine if you have underlying conditions, if you have high blood pressure. A test for hepatitis C based on your history. Non-stress tests can also be ordered. Those would be tests that you would come down to our department. We would put you on a fetal monitor, and we monitor the baby's heart rate and whether you're having any contractions, and making sure that the baby looks good on the monitor. And what determines whether they look good or not is if their heart rate goes up whenever they move. We also offer prenatal classes free of charge. Those classes include healthy pregnancy, childbirth education classes, infant care, and breastfeeding classes. If you're interested in those classes, they're available here. You can call for dates and times. You can call area code 814-938-1806 and leave a message, and we will get back to you on that. If you would like to register for the classes, you would want to call 814-938-1845, and that's our central scheduling department, and they will sign you up for those classes. And if you have any questions on prenatal care, you can call either the office at 814-938-3343 or you can call the department at area code 814-938-1895.